Hey guys, Curtis Alexander. In this video, I want to talk about PEMF therapy. Now, PEMF is pulse electromagnetic field therapy. I've done other videos where I delved into specifics, whether it be side effects or benefits, and talked about some of those things, but I want to make a video that's kind of a 101 explainer video for anybody. If you're coming to this and you want to kind of understand what PEMF therapy is, what it can help with, what it can't do, costs, those sorts of things. So this is kind of going to be an overview video. So let me just hop right into. So first of all, what is PEMF therapy? You have to understand first that your body is electrical. Now, what do I mean by that? If you have a heart problem, your doctor is going to get an EKG, electrocardiogram. If you have brain issues, your doctor may get electroencephalogram. So these electrical impulses in our body happen everywhere. They happen at a cellular level. For example, we have what are called voltage-gated channels, where those channels to open up to let nutrients in, for example, to let calcium in, those gates require a certain voltage to open. So your body's electrical. What PEMF therapy does at a very basic level, the easiest way to explain it, it's sort of like recharging a battery in your phone, because as we get older, and as a lifestyle, maybe our lifestyle wasn't so good. We know from studies, there's plenty of studies on PEMF therapy, that those charges in our body tend to go down. When they do, we are not going to do as well, because we do need a certain charge in our cells for those basic things to happen. Okay. So in a nutshell, that's what PEMF therapy is doing in your body. It's very beneficial. Now, what exactly is going on when you do this pulsed electromagnetic therapy? Well, at a cellular level, it is going to help your mitochondrial function. Okay, because again, those channels open, we're letting nutrient in. Some of these toxins can get out, but they have shown in studies, and these are at well-established universities like Old Dominion University has a whole school dedicated to studying this stuff. But basically, we can see increased mitochondrial respiration. That means you're going to have more energy. More energy means you're going to be able to deal with life better. You're going to have more energy to be able to help with organ function. You have energy to do things in the day. If your mitochondria are healthier, you're going to be healthier. It's really that simple. It can also help you increase the number of mitochondria that you actually have, which is extremely important. Okay, so that's why we're able to see so many benefits from PEMF therapy, because it's actually working at a cellular level to help your mitochondria. Now, let's talk about side effects. Okay, people will often ask, is this dangerous? Is this going to hurt me? Generally speaking, and this is coming from a lot of experience, my wife and I own a PEMF therapy business, which we later sold only because we got a very good offer for it. It wasn't because it was a bad business. It's a great business. But during this time we have this business, you saw very few side effects in people. If you saw any, it tended to be people that were almost like detoxing. Some people would come to us and they had trouble going to the bathroom. Well, halfway through the session, they're going to the bathroom, if you want to call that a side effect. Some people would experience headaches because they tend to be flushing toxins. It tends to be in the first session. So pretty minor things, but headache could be one. Particularly if you try doing PEMF therapy too close to the head, you can do it around the head, but you do have to be more careful because it's such a sensitive area. But as far as side effects, are very, very minimal. It really is something that truly benefits your body. So we never saw very many side effects. So one thing I will say, if you're on things like painkillers, it may increase the effect that you're getting. So you have to be very careful. You want to drink plenty of water the first couple times that you do it, because your organ function is going to likely start getting better. You're going to flush some of these things. So be thinking about consuming water. Another good question is cost. What are you looking at for cost? Now, this is a tough one because there's a broad spectrum of machines out there. There's low-end machines that can run 100 to 1,000 to 1,500. Now, maybe that's not low cost to you. but that's just where the market is. That is considered a low-cost PMF machine. The machines at the high end can run upwards of $40,000. So that's kind of the range you're looking in. Obviously, most people want to purchase a less expensive machine, but here's what I found. Okay, we, meaning my wife and I, when we first started this, we did start out with lowering machines, didn't get very good results. And I think it gives PMF a bad name. I think PMF is truly one of those things where you get what you pay for. If you want to cheap out, you're probably not going to get the results that you're hoping for. That doesn't need you need to go out and buy an expensive machine. I would encourage you to find people who are doing sessions in your area and just pay them per session, see how you feel, see the improvement. But I always tell people, try the machines first. If you can't try them, don't buy them. You need to try them first. But you really do get what you pay for with PMF therapy, and there is a very broad range. Other people ask, well, what does this feel like? It's a very difficult sensation to describe. On the low end of the scale that we just talked about in the cheaper machine, you really don't feel a lot. I didn't. When you get to the higher end machines, you definitely feel it. Now, what does it feel like? It's difficult to describe. The machine will tick. You feel this pulse into your body as you increase the intensity. You can see the body begin to move as it pulses the frequency into you. But it's very comfortable. It's very relaxing. A lot of people will fall asleep. We've had it help people with PTSD, with insomnia. Very helpful for back pain, any sort of pain. It's very, very helpful for. But it really depends on the power and the frequency that you're using. I use it every day, particularly before bed. It's very relaxing, helps me sleep. But it is a unique feeling, and it's hard to describe until you actually get on the machine. Another question, is it like a TENS unit? Now, a TENS unit, if you're not familiar, a lot of physical therapists and so forth will use these. They attach little electrodes to you, and it kind of shocks your body, more or less. And it's a treatment modality. But a TENS unit is nothing like PMF therapy because, like I talked about earlier, PMF therapy is addressing your body at a very cellular level, whereas a TENS unit is going to be more surface level. It is not addressing your issue at a cellular level. It's addressing it more at a musculoskeletal level, not cellular. So no, it's very unlike a TENS unit. Another question is, how long do I need to do this to experience results? It's going to vary per person. And the reason I say that is because it depends on a lot of factors. What's your age? What kind of health condition are you dealing with? We've had people who came to us who benefited with Parkinson's. Parkinson's is an extremely serious, long-term progressive disease. So it took many more sessions. Okay, it wasn't somebody who could come into us with back pain, and after the first session, they're like, oh, I feel better after the first session. For Parkinson's, because it's more serious, it's going to take multiple sessions. We would have to have people on the machine for 10 to 20 sessions, and they would slowly start to see benefits. But it really depends on many factors. So I always tell people it depends on you. But if you don't have something like Parkinson's going on, something like back pain, insomnia, you could notice it within 1 to 3 sessions. And that kind of comes back to another question, which is how long do you need to be on it? I always recommend people do an hour-long session. Okay, you can potentially get some benefit doing it half hour, but it's awesome because you can just sit down, turn on the TV and do it. It's a very passive thing that you do. You just sit there or lie there and you don't have to do anything. So you can do other things while you're doing that. But I would say for most conditions, if you do a few 1-hour sessions, you're going to know if you're getting benefit. And most people do. I would say when we had the business, you're going to see 70 to 80% of the people want to move forward with packages and want to do this long term. 90+% of people got benefit, but not everybody can afford to continue to do therapy. So very, very high success rate. It takes a little time, but I think it's well worth the effort if you look at your other options, drugs, surgery, and cost and so forth. Another question is, who should or should not do PMF therapy, meaning, hey, I have this condition, can I do it? For almost everybody, it's doable and beneficial because, again, it's helping your cellular function. Now, with that being said, if you have any sort of implantable electronic device, pacemaker, a deep brain stimulator, things like that, it would be a no-go because a PMF device could potentially interfere with those electronic signals that are being sent from your device. So those would be hard no's. You do not want to do it if a woman is pregnant. Not because it would be harmful, but because basically it's a precautionary thing, and I'll just kind of leave it at that. But by and large, outside of those things, people have said, well, what about seizure disorders? I've seen a benefit seizure disorders. Other people will say, well, you shouldn't do it. Your mileage is going to vary there. It's not a contraindication for most devices. Some companies will say you can, some will say you can. I've seen it benefit it, but I get that some people don't want to use it in those conditions. But outside of those few things, it pretty much benefits everybody, again, because it's helping you at a cellular level, which is kind of what you're seeing here. So let me know in the comments, guys. That's kind of the main questions that I tend to get with PMF therapy. Let me say this. If you're interested in PMF therapy, if you want to know the machines I personally use, I don't like to recommend machines on my channel because I just want to put the information out there. And like I said earlier, you need to try machines. But if you want to know the one I use, and I have these in my own home, join my email list, get your free checklist, because I talk about a lot of other things besides PMF. We'll give you options outside of drugs and surgery. Go to my website, get your free checklist, and then you'll have the ability to reach out to me and go ahead and I want to know what machines you use, and I'll send that information to you. But I don't want to push those on people. I want you to kind of go out and try machines and see what you think. So let me know in the comments other topics you want me to cover, and I'll get on those videos. And I hope this was helpful, guys. See you in the next one.